layers and the shape, okay?
Yeah.
So which slide are we up to?
This one.
This one?
Yeah.
Simple columnar.
Okay, simple columnar. So what does simple columnar mean?
Simple is one single layer.
One single layer?
Columnar is cube shape.
No.
Oh no.
Column shape.
Column shape.
Like
Yeah.
this. You
Oh,
see
yeah,
here?
yeah,
So simple columnar.
yeah.
So it's one layer of column shape, tall or rectangular cells, okay?
Yeah.
Now these cells, you find an example of this type of epithelial tissue is in the small intestine, where it has these, if you see closely, these little hair-like structures, which we call the brush border. It's actually the microvilli, okay? It looks like a, you know, your brush that you comb your hair with?
Yeah.
It looks like that. That's why it's called a brush border. So we find that structure in the epithelial tissue of the small intestine because it increases the surface area, makes absorption of the nutrients more efficient, okay? Because there's more surface to do it. So in between, we find some cells called goblet cells. Remember we talked about unicellular and multicellular glands?
Yeah.
So these goblet cells, we find them individually here.
Unicellular.
These are unicellular glands that secrete mucus, okay? And mucus is very important because it acts as a protection against the digestive enzymes, so it doesn't break down the cells of your body.
Okay,
Okay.
what's a goblet?
Goblet is just referring to these large cells.
Oh, like
Okay.
cups.
Like a cup, you know that
Okay.
goblet is a cup, yeah. So you see, it looks like those cups when you look closely to it. So that's why it's named goblet cells, because they resemble those cups. So it acts. This mucus acts as a trap for bacteria, viruses, and sometimes lubricates. Okay, but also it helps to protect as well from the digestive enzymes. So most of the digestive tract is composed of this simple columnar epithelium, just like the small intestine. Okay. So in this case, it's absorbing nutrients and it produces mucus via the goblet cells. Okay. So when your digestive system breaks down the nutrients into simple subunits like amino acids and glucose, okay, or fatty acids, then they're taken up by the simple columnar epithelia of the small intestine. And that brush board, as I mentioned, that microvilli are very important in these type of tissues. So their function is more in absorbing nutrients and producing mucus.
Yeah.
Okay, so one layer of columnar epithelia.
Simple.
Yeah, simple columnar epithelium. So it looks like, you see here, it's how do you tell the difference between this and the pseudostratified?
They're all in the same level.
So which are the same level?
Not
The nuclei, the nuclei, okay? And all the cells are facing the free surface, okay? Unlike the pseudostratified, where not all the nuclei are on the same level and not all the cells face the free surface, okay? So that's how we differentiate between the two type of tissues, because they look very similar when you look at them. The defining feature is the level of the nuclei and the cells, if they're facing the free surface or not, okay?
Okay.
So now we look at the stratified epithelia. So what was the definition of stratified?
Multiple layers.
Multiple layers, okay? So more than one layer. Any epithelial tissue that has more than one layer, we begin with then naming it as stratified, okay? So stratified epithelium. So, and then we have stratified epithelium in the different shapes. We got stratified squamous epithelium, okay? So remember those flat cells? So in this case, lots of those flat cells, one on top of each other, many layers of it. And this is very important in regions like the skin, the mouth, and vagina in the female reproductive system, okay? So you know, the cell always is shedding your skin because you're always producing this stratified squamous epithelium. It's important for protection, okay? So against abrasion. Remember, abrasion is like two things rubbing on each other, okay? So your skin, you know, you're always touching things. You know, when you're moving around, you always your body is, you know, touching objects. So there is friction. If the skin didn't have multiple layers like this, it will cause damage to the internal tissues, okay? So the skin acts as a protection against abrasion and drying. So if you didn't have the skin, you will lose lots of moisture. You will dehydrate, okay?
What's mean moisture?
Moisture, water, okay? And infection. Obviously, the skin is a very important first line of defense, okay? As is, you know, the mouth, okay? The mouth is also stratified epithelia, okay? Squamous epithelia. So stratified squamous epithelia is very important in protecting against abrasion, okay? Like friction, okay?
Yeah.
So drying, so you don't lose the moisture, the water, and infection. So bacteria cannot penetrate through the skin. So the skin is actually the first line of defense in your immune system, okay? So it's a barrier against bacteria, viruses, and so on. So then we have the stratified cuboidal epithelium. So remember, cube shape, so multiple layers of that. We find that in the sweat glands. Remember those glands that we talked about producing the sweat?
Yeah.
Okay? So actually the epithelia surrounding those sweat glands here it's actually depicted. If you the sweat glands look like that, but there's only shown one layer here, okay? But in the sweat glands you find multiple layers, stratified cuboidal epithelia, okay?
Like this one?
It doesn't actually show the gland, okay, with the epithelia. Not sure. Yeah.
Cube.
That's the
cube.
Yeah. So, but it's in the gland tissue itself, okay?
Okay.
So we find that stratified cuboidal and the sweat glands, which produce water and ions, okay? It's important in maintaining your temperature. So if it's very hot, remember, you sweat because your body's trying to cool down. So the sweat glands are lined with this stratified cuboidal epithelium, which produces the water and ions that cools you down, okay? Then we have the stratified columnar epithelium, so multiple layers of this columnar epithelia. We find these in the epididymis, which is a duct or a channel or a tube, you could say, found in the male reproductive system where the sperm travels through that, okay? So you find the lining of that tube, okay? I think there's one in the beginning. So here you find that, so the sperm in the male are produced in the testicles, okay? And they travel through this duct, okay? This epididymis, okay? And during ejaculation, so that tube or duct is lined with stratified columnar epithelium, okay? And it has some goblet cells in there as well, so it produces mucus as well, okay?
Okay.
So we find it there, this stratified columnar epithelium. We find it in the mammary glands, okay? The mammary glands are we find them in mammals, you know, they produce milk, so the mammary glands, the breasts and in the humans, okay? So they're lined with stratified columnar epithelium. So in this case, it will be producing what?
Mammary gland.
The mammary glands will be producing what?
Milk.
Milk, okay? So those stratified columnar epithelium cells are producing milk. And the larynx is the voice box, okay? So in the voice box, I don't know if there's a...
It's a voice box or surrounds the voice box?
It's in the voice box, okay?
In the voice box.
In the voice box we find stratified columnar epithelium, okay? So stratified columnar epithelium,
It's like the throat.
the voice box, you know, where you
The
produce.
throat.
Well, the throat isn't
Hanjara.
inside your mouth, not
أيوة. Throat حنجرة.
where the voice is produced. You know, the throat is not. It's not the throat. Yes.
Like near the vocal cord.
Yeah, the vocal cord are inside the larynx. Okay, so the voice box. All right. The throat is different to the larynx. Okay.
Okay.
So all of these tissues or glands or I should say organs are covered with this stratified columnar epithelium, and it says here they secrete mucus. So in these two cases it secrete mucus. In this case it's actually making milk, okay, in the mammary glands.
So larynx and epididymis
Yeah.
with mucus.
Yeah.
Normal glands for milk.
Yeah, milk, yeah. Okay, so how are these? Remember that we said that the epithelial tissue has very little extracellular matrix. They're packed together in sheets. So there's some proteins which hold these cells together, okay? And we call these proteins, remember we adhesion proteins, we talked about them before, that are on the membrane.
Yeah.
Okay, so in chapter 3. Chapter 3, adhesion proteins, okay? There's actually 3 types of them, okay? So their function is to hold adjacent cells together, okay? So there's 3 types and each one has a different function, okay? So the first type is called a tight junction, okay? In this case, these proteins on the membrane surface hold the membranes of 2 adjacent cells very tightly, making them waterproof, okay, or liquid proof. So there's no seepage, there's no leakage of liquid between the cells. And this type of junction is very important in the digestive tract. You know, you don't want any leakage of enzymes or anything into the tissue, okay? In the bladder, you don't want any urine leaking out of the bladder, okay? You want the bladder to be nice and waterproof, okay? Or in the kidney tubules, okay? Remember the kidney tubules, those structures we saw here, okay? So
Absorption.
So yeah, absorption. You see between the cells, there should be no leakage, okay? So what we find is tight junctions between them, okay? Makes them waterproof, okay? So these type of junctions, adhesion molecules, make that particular organ waterproof, so there's no leakage. And this is important in the kidneys, in the bladder,
Digestive tract.
and in the digestive tract, okay? So it controls the movement in and out of that particular organ, okay? So there is no leakage of the liquids.
Okay.
We got that?
Yeah.
All right. The second type of adhesion junction is, or we call it adhesion junction or spot desmosomes sometimes, okay? These have a looser structure. They're not waterproof like the tight junctions. They give some strength, moderate strength, okay? But allowing flexibility, like in the skin, you know, it's very flexible, okay? So, you know, you can stretch your skin a lot if you try to pull it. It's because the epithelial tissue have these spot desmosomes or adhesion junctions between them that give some, strength, but it gives it a lot of stretch, okay? So the tissue can stretch, like the skin.
But nothing can move inside.
Well, sometimes the water, you know, can move out when you sweat, you know.
Yeah.
You know, it's not waterproof. Like if you put your hand in water for a long time, you get water and, you know, your hands feel like yeah. So it's not watertight, okay?
Yeah. Okay.
But it gives it allows movement and stretching of the tissue, okay? So we find it in the skin, this adhesion junctions or spot desmosomes, all right? It's not as strong as the tight junctions, okay? Then we have these gap junctions. These are very important because they're actually like a channel between two cells. Allows for cells to communicate with each other and send ions and water to one another, okay? So it's actually like a pipe between two cells, if you see here. So it's actually protein channels fusing together from two different cells that form these gap junctions. These are important in liver, heart, and muscle tissues, okay? Some muscle tissues. Because sometimes, it allows the ions to pass from one cell to the other, sometimes generating electrical impulses, okay? So it allows for coordinated contraction of the muscle, specifically, in the heart is very important, okay? To allow the chambers to contract at the same time, so when they can both chambers. So remember, the heart is 4 chambers,
Yeah.
two
Yes.
upper, 2 lower.
Two down.
So each time 2 contract while the other 2 relax. Okay.
Yeah.
So these gap junctions are important, allowing coordinated contraction of those muscles. Okay. All right. So we have 3 type of junctions between the epithelial tissue. One, to make it waterproof. The second one, it gives it some strength but flexibility.
Yeah.
The third type allows for molecule exchange like ions and water between the cells next to each other. Okay. All right. So let's move on to connective tissue. We finished with the epithelial tissue. So it has many functions here. So it supports softer organs of the body, okay? So some soft organs inside are covered with connective tissue to protect them and support them. It connects body parts. So like, tendons connect muscles to the bone, ligaments connect bones to each other, okay? So it can connect body parts. It stores fats like, under the skin and surrounding some organs, we find fat. This is connective tissue. Fat is what? What is the fat for?
Lipid.
Yeah, fat is used for long-term energy. Okay.
Yeah.
So yeah, long-term energy. It produces the blood cells. So blood is a specialized type of connective tissue. It's very important in moving nutrients around the body and give oxygen and removing waste, okay? And also in defense. So we find in connective tissue cells which are embedded in the extracellular matrix, which is non-living, okay? And this is synthesized by the connective tissue cells, all right? So remember, the extracellular matrix is in terms of connective tissue, you got the cells, okay?
Mm-hmm.
And whatever's on the outside, it's got fibers and other proteins and carbohydrates and water on the outside. That is the extracellular matrix, okay? So, and the living cells are here. So remember, the extracellular cell is non-living while the cells are living. And this matrix is produced by these cells and they secrete it out into the outside of the cell, okay? And this is what gives strength to the connective tissue, okay? So it can be sometimes liquid, as we mentioned. It can be jelly-like, semi-solid, or solid. So the strength of the connective tissue comes from the matrix, not the cells.
Doctor,
Yes.
what is mean in support softer organ? What is softer organ?
Soft organs like the liver, like the
Lungs?
pancreas, lungs, and so on. So these organs, they help to support them, okay? If you look at connective tissue, we have 2 types. We have fibrous and specialized, okay? So in terms of the fibrous, we have 4 types. So the loose areolar connective tissue, this is, you find it a lot around the softer organs, okay? Internal organs, and also muscles are wrapped with these loose areolar connective tissue. Then you find the dense connective tissue. These have more fibers, okay? So as the name says, loose, they have less fibers, okay? Compared to the dense. They're more tightly packed, the fibers, and you find this in the tendons and ligaments, okay? So the dense connective tissue. Then you find the elastic, okay? Elastic connective tissue that stretches. You find it in organs that stretch, like the bladder, okay? So the bladder has elastic connective tissue. And reticular connective tissue, you find this in organs like the spleen, the liver, and lymphoid tissues. It acts like it's thin fibers, okay? It contains, it acts like a network to support the cells. So we will talk in more details in the coming slides about those type of tissues, okay? So don't worry if you didn't get that yet. So,
Doctor, example of dense tissue as well?
Ligaments and tendons, okay?
And the inferior.
Loose, so it's areola, okay?
Oh,
It's called.
areola.
But I'm just summarizing here, okay?
Oh, okay.
We're gonna go into detail. So the specialized connective tissue we find like cartilage, okay? Cartilage we find in a lot of places in our body. Actually, our skeleton, you know, before we were born, as it develops, the skeleton develops as a cartilage before it mineralizes into bone, okay?
Yeah.
And some remnant of that still exists in our body today. The end of the nose. This is
Also the
yeah. The ear is cartilage, but a different type. But the one that still remains from when you were inside your mother's womb is the nose cartilage. Okay, this used to be the same as the bones. Okay, but it didn't solidify. It remained as a cartilage. I'll talk about in more details about the different type of cartilages. Okay, I'm just summarizing here. And then you got the blood. Obviously, you know, it's very important in carrying nutrient throughout the body and removing waste and defending us against infection. Okay, so this is a specialized connective tissue. You got the bone. Remember, the bone has that rigid, solid extracellular matrix. It gives our body our support, so we, you know, make us stand upright and then allow us to move around. Okay, so the bone is very important. And then you got adipose tissue. This is just, adipose is just another term for fat. Okay, so fat tissue. All right. All right. So this table summarizes the different types of connective tissue. It gives you the type of tissue, its structure, what it's made up of, and its some of its characteristics and where we find it. Okay. So we're gonna go through all this in more detail through the slides, but this just is a good summary for you. Okay. So I'm not gonna go through this one. I'm just gonna go through with the slides. It's the same information. All right. That I'm going to go through, but it's summarized in this table.
All right.
So if we look at the fibrous connective tissue to start off with, so if you're seeing CT here, it's referring to connective tissue, okay?
Okay.
Just in case anybody asks. So as we said, the functions are it connects body parts, it provides strength, support, flexibility, okay? So this is the fibrous connective tissue. Now they have these protein fibers in them, cells which are embedded into a ground substance. Okay, so the ground substance is made up of water, ions, and proteins and carbohydrates. Okay, so remember we have the extracellular matrix. So you got the cells. So here are the cells. Anything outside of the cell is extracellular matrix.
It's non-living.
Non-living, yeah. So the ground substance is actually everything except the fibers, okay? So all the water, the ions, the proteins that are in this ground substance are the ground substance except the protein fibers, all right? So we got the protein fibers, the cells, and the ground substance. The non-living part is the protein fibers and the ground substance, which make up the extracellular matrix, okay? So the extracellular matrix is made up of,
Protein and the ground substance.
yeah, okay? So we find different type of cells in here, in this fibrous connective tissue. We find that the most important cell here is called the fibroblast, okay? So where is it mentioned here? Here on this cell, all right? So fibroblast. These are the cells that produce the fibers, okay? That make up the connective tissue, all right? So the fibroblasts are the important cells in the fibrous connective tissue. Then we find embedded other type of cells, immune cells like macrophages, lymphocytes, neutrophils, plasma cells, mast cells, okay? So these are very important in defense. Now we're not going to talk about the immune system in detail here. We're just mentioning these cell types. So I'll just, basically you need to know that they're important for defense, or sometimes what we call inflammatory response. They release chemicals known as histamines, okay?
Histamine?
Yeah, I'll talk about it in the next slide. So we find these immune cells, then we find obviously the nerve fibers, all right, because they're important in generating those electrical impulses. So all the tissues in your body have nerves in them, okay? So the nerve fibers. So that's the cell types we find there. Then we are actually, so also we find some fat cells. Remember the fat cells?
The adipose.
Adipocytes, okay? So we find this in fibrous connective tissue as well, fat cells, all right? Produce the fat for long-term energy. Then we have the different type of fibers, okay? So we have the three different type of fibers. We have the elastic fibers, okay? These are thin fibers that can stretch, okay? And they're made up of a protein called elastin, okay? Then we have the much thicker fibers here. We call them the collagen fibers. They're mostly made up of collagen, okay? So they're strong collagen fibers. The reticular fibers, they're much thinner, these ones, okay? So they're important in organs and act as a network, a lattice to support the cells, okay? And soft organs like the liver, the spleen, and the lymph nodes, okay?
Reticular fiber act as a network.
So the reticular fiber, yes, and they're made up of collagen, okay? You see, they make up this network of fibers, interconnected, branched, okay?
Okay. And the collagen fiber.
Collagen fibers that gives it the strength. They're very strong ones, okay?
Right.
And then the elastic fibers, they give the tissue elasticity, okay? Like in the bladder, you know the bladder, when it's full, it stretches. When it's empty, it distends, okay? So it has that ability to stretch because of these elastic fibers, okay? So let's just look at that in detail, all of the different parts of the fibrous connective tissue. So as I mentioned, you have the ground substance, which is made up of polysaccharides, water, and proteins, okay? So that is everything except the fibers and the cells, all right? So that's what we call the ground substance, and it gives the connective tissue its characteristics, okay? So in terms of fibrous connective tissue, we have two consistencies, one a gel-like or one rubbery. So we find a gel-like consistency in loose fibrous connective tissue, okay? Like loose areola, you know, it's more jelly-like, okay? You eating jelly at home? Yeah. So the loose, or in the liver or in the spleen, okay? It's very soft. You know,
Yeah.
if you touch the liver,
Yeah.
it's very soft, very jelly-like consistency, or very rubbery. You know, like the tire. You know, on your car, rubbery. It's not rigid, but it's very strong and rubbery, like the cartilage. Okay. Oh, sorry, like the I should say,
Sorry.
like the tendons. Okay, and ligaments.
On the dense.
Yeah, dense connective tissue. So that's what the consistency of this ground substance is in the loose connective tissue. It's, I should say fibrous connective tissue, from a gel-like in the loose connective tissue to almost rubbery-like in the dense connective tissue. So that's the ground substance. The cells, as I mentioned before, we got the fat cells, which store fat for long-term energy. Remember the lipids? Then you have the different type of cells of the immune system. You got the mast cells. These are specialized cells that release histamine. Histamine is very important in the inflammatory response. I'm not sure if you've learned about that, but we will learn about this in next semester when we're taking the immune system. Okay, so in the immune system, you got your skin as a first line of barrier. If that's penetrated, underneath the skin you find loose areola connective tissue surrounding the muscles and so on. They contain these mast cells which produce histamine. Okay, and this causes inflammation. You know, if you get a cut,
Okay.
if you get infection, it becomes red.
Yes.
This redness is called inflammation, okay? So this histamine is very important in causing this, okay?
Like this, become.
Yeah, or sometimes you have allergies, something in your hand swells or something. It's because of release of histamine, okay? Causing a.
Oh.
So white blood cells are very important in defense, okay? So you got different type of them in the loose connective tissue or fibrous connective tissue. You got the macrophages, neutrophils. So these are phagocytic cells, remember phagocytosis?
Yeah.
Brings in the bacteria. Then you got the more adaptive immune cells like the lymphocytes, and you have plasma cells. All these make up the immune cells. They are very important in defense. If you get bacteria infecting these tissue, there's already multiple different types of immune cells ready to defend you against them, okay? And so both of those cell types, as I mentioned, are a part of the immune system. Then you got the fibroblasts. These are the important cells. They produce those protein fibers we talked about, okay? And that protein fiber gives the strength to the tissue, okay? So the fibroblasts are the cells that produce the protein fibers. You remember the collagen, the elastic fibers, and the reticular fibers, all produced by these cells, were the fibroblasts.
And it's produced the protein.
It
from the
produced,
fiber.
yeah, yes. So let's have a look at the different type of fibers produced by these fibroblasts. So we said we got the collagen fibers, okay? So these are made up of collagen. They're slightly flexible, but they're very strong, okay? These are the stronger fibers, okay? The collagen fibers, the white fibers. The elastic fibers, these, well, they're not yellow, they're more of a light, I don't know what color is that? Orange, yeah. Okay. So these are made up of another type of protein called elastin, and they're much thinner when you look at them compared to the collagen fibers, and they have these coils in them. Just like a spring, you can stretch it and it recoils back, okay? So it's important in tissues like the bladder, so they can stretch without breaking, and recoil to return to the normal shape.
One line.
Okay? So organs like the urinary bladder, you know what the bladder is?
Yes.
Okay. So these type of tissues have these elastic fibers or elastic connective tissue which can stretch without breaking, okay? Because of that coiled nature you can see there. And then the last type of fiber we find in this fibrous connective tissue is called this reticular fibers, okay? These are thin collagen fibers and they have branches, as I said. Network of branches, and within these branches the cells lie and it gives it support to the cells, okay? Acts as a support, as a framework for the cells, alright, for the tissue. And they're found in very soft tissues like the organs like the liver, you know the liver, you know the spleen and the lymph tissues, okay? So soft tissues, soft organs have these reticular fibers. So
What is the lymph nodes?
lymph nodes, you find them under your armpit, between the joints, your tonsils, okay? These are lymph tissue. They're important in the defense, okay?
So the
In the lymphatic
fibers,
system, huh?
They're thinner than elastic fibers.
Yes, they're thinner and branched. The blue ones, you can see that?
Everywhere.
So the three type of fibers. So collagen fibers and reticular fibers are made from collagen. Here they're strong fibers, okay? Much thicker. Here they're thinner fibers and branched. While the elastic fibers are made up of elastin, they have this coiled structure and stretch and recoil, okay?
Without breaking.
In organs like the urinary bladder. Any questions on that? Yes.
Reticular is made from collagen fiber or
Yes, it's
protein?
collagen. It's made from collagen, the protein, okay?
The protein, not
Yeah,
the fiber.
so, yeah, not the fiber. So collagen fibers are fibers made up of collagen, but they're more strong, slightly flexible and thicker, okay? While these reticular fibers are more thinner, they're made from collagen, but more thinner, branched, connected to one another, alright? Okay, so the first type of fibrous connective tissue is the loose areolar connective tissue, okay? So we classify these based on the density and arrangement of their fibers, okay? So in the first type, it's loose. The fibers are loose. They're not well organized, okay? They're far apart, okay? That's what loose means. You see here, the fibers? You did the lab, did you? You saw under the microscope this type of tissue?
No.
Loose.
Still didn't do it. We'll do it tomorrow.
After.
After tomorrow.
Okay, so you haven't done it. So when you look under the microscope, if you get the loose areolar connective tissue, you will see that it has these fibers not well organized. Okay, so they're in random order, and you find them that they're not as dense. You see lots of spaces between the fibers. Okay, so that's why it's called loose areolar connective tissue. And you find this is the most common type. So it's made up of collagen fibers. You see the collagen fibers? The pink ones. And then you see these darker ones. These are the elastic fibers, okay? Made up of what protein? Which protein makes elastic fibers?
Oh, elastic fibers.
Elastin protein.
Elastin, okay? So this has more flexibility, but a modest amount of strength. They're not as strong as dense connective tissue. So they have some strength, but more flexibility. Moderate strength. You find it around the internal organs, inside organs, all the organs. The covers the muscles, and you find it around the blood vessels, okay? So it gives it a modest strength, but more flexibility. Because the fibers are not arranged they're random, they are far apart, so that's why the term loose. Okay? Alright?
Okay.
In dense connective tissue, the fibers are more organized, okay? So you see more, the name obviously gives it away. You see that the fibers, in this case, if you have a look at here, so this is a tendon, okay? Remember, tendons connect muscles to bone, alright? So the fibers, if you have a look at it, are really packed together. There's very little room, and they arranged all in this parallel arrangement, okay, right next to each other. The reason is this gives this tendon strength. I'll give you an example, okay? If you get a string, you know what a string is? One string, and you try to pull it, does it break?
Yes.
Yeah, the sewing, you use it for sewing. Your mom does the sewing, If you get one string and you pull it, it'll break, correct? Get 100 of them and put them together and try to pull. Will it break? No. So this is what's happening here. These fibers are arranged densely like that to give the tendon strength. These athletes, and sometimes they can lift like how many kilos? 300 kilos?
Yes.
So those tendons need to be really strong to lift that weight. So they're very strong. So when they're arranged in this order, many fibers together, it gives it that strength. If there was one fiber and loose fibers, it's not going to have strength. So this arrangement, this dense arrangement of fibers, these collagen fibers, so these are the strong fibers, remember? In one direction, okay? So we find that in this type of tissue, in the tendon, it's very important because the pulling is in one direction, okay? So when the muscle pulls, it's pulling this way, it's not pulling that way, correct?
Okay.
So the fibers have to be aligned in that direction to give it strength.
Parallel, okay.
Parallel, in one direction. So we call this type of dense connective tissue regular because the fibers are all arranged in one direction. When the fibers are arranged in different directions, so you see here, some of the fibers are arranged in this way. So there's lots of fibers here going this way. Then there's some fibers going this way. They're still dense, but they're not like a regular pattern, okay? So we call this irregular, all right? Now, if you noticed, if you played soccer, you rip one of your tendons, you're out of the game for how long? A long time.
Yes.
Because it heals very slowly, these dense connective tissue. The reason is it has very limited blood vessels. Very few blood vessels, so it heals very slow. So if you break a tendon, it's not going to heal for a long time. The reason is there's not enough blood flow and nutrients cannot come. So repair is very slow.
That's why people cast.
Well, I'm not sure for tendons they put casts. For bone they put casts.
Yeah.
But
Is it the same thing?
no, bone is
Yeah,
different.
they do surgery for it.
Yeah, they do surgery. They connect it somehow. I don't know. They staple them or they stitch them or whatever. But they don't heal very well because there's the blood vessels. There's not many blood vessels found in this type of tissue.
Okay.
I was gonna do Kahoot, but let's finish this slide. We only got 3 minutes. We'll do Kahoot next week, okay? Inshallah. All right. So we said there's dense. So we find this in the tendons and the ligaments. Dense regular, okay? Because the fibers are in a regular pattern, it gives it that strength. Both ligaments and tendons. So ligaments connect bone to bone, okay? So their strength is in one direction as well, as is the strength of the muscles which are connected to the bone. So the tendons also have this regular pattern of the fibers. So we find that in tendons and in ligaments. So tendons connect muscles to bone, ligaments connect bone to another bone in the joints. You find them in all the joints, okay? Then you have this dense irregular, where it's dense fibers, but they're not all in one direction. These are, we find it in the dermis, in the lower layer of the skin, okay? It gives us protection and support, okay? It helps cushion us, you're always hitting something, you're bumping into things. This dense irregular connective tissue under the skin helps to cushion the blows, okay? When you hit things, walls, you trip over, whatever. How much time do we have?
1 minute.
This is not a 1 minute slide. So we'll do it next week, inshallah.